The AHA adult chain of survival involves 6 important links. First, immediately recognizing the emergency and phoning 911. Second, performing early CPR with an emphasis on chest compressions. Third, use of an AED immediately as soon as it becomes available. Fourth and fifth, advanced care is provided through advanced resuscitation and post-cardiac arrest care. And the sixth and final step of the adult chain of survival, additional treatment, observation, and rehabilitation may be needed to fully recover from a cardiac arrest. When encountering a possible cardiac arrest, there are 5 steps you want to take. First, make sure the scene is safe. 2, tap and shout the victim to check for responsiveness. 3, shout out for help. 4, instruct someone to phone 911 and get an AED if available. And 5, check for normal breathing. After checking for breathing, if the person is not responsive and is breathing, this person does not need CPR. Roll them onto their side. If you do not suspect of a neck injury or back injury, this will help to keep the airway open and clear in case the person vomits, and stay with the person until advanced help arrives. If the person is unresponsive and not breathing, or is only gasping, this person needs CPR. Make sure the person is lying on a flat, firm surface and begin CPR immediately. Performing high-quality CPR involves 2 main skills: providing compressions and giving breaths. Compressions are given at a rate of 100 to 120 compressions per minute and a depth of 2 inches or 5 centimeters. You should push hard and fast when giving your compressions, and you should allow the chest to rise back to its natural resting position after each compression. After giving 30 compressions, you should pause for no more than 10 seconds to give 2 breaths. You'll know that your breaths are effective if you see the chest rise. You should allow the chest to fall back to its natural resting position in between each breath. When giving breaths, you may use a barrier device or a pocket mask with a one-way valve. A barrier device or pocket mask may be used to reduce the risk of infection. When the AED arrives, use it immediately. Turn on the AED and follow the prompts. You can turn the AED on by pressing the on button or lifting the lid. Follow the prompts, which will tell you everything you need to do. Attach the adult pads, using adult pads for anyone 8 years or older. Peel away the backing from the pads. Follow the pictures on the pads and attach the pads to the person's bare chest. Plug the pads connector into the AED. Let the AED analyze the rhythm. Loudly state clear and make sure that no one is touching the person.
Shock advised.
The AED will analyze the heart rhythm. If the AED tells you that a shock is not needed, resume CPR. If a shock is needed, loudly state clear and make sure that no one is touching the person. Push the shock button. If the person is still not responsive and not breathing, immediately resume CPR.